Hey everyone, and welcome to This Explainer. I am so incredibly glad you're here today. We're diving into something that affects literally millions of people, but somehow still manages to be wrapped in so much mystery and frustration. Yep, we're talking about endometriosis. We've pulled this together based directly on expert guidance from Fertility Clinics to give you a really supportive, no-nonsense guide. Whether you've just been diagnosed, maybe you've been battling this for years, or you're just trying to figure out what it means for your dreams of starting a family, we're going to break it all down together. So let's just get right into it. First off, if your periods are intensely painful, you are not alone. And I really want to emphasize this, it is not just in your head. For way too long, people with endometriosis have been told that their agonizing pain is just normal. Well, it's not. Your pain is totally real, your experience is completely valid, and if you're feeling anxious about your health or your fertility, that is 100% understandable. You are absolutely in the right place to get some clarity today. To keep us on track, here's a quick roadmap for today. We're going to cover understanding endometriosis, spotting the symptoms, getting a diagnosis, how it impacts your fertility, and finally, your paths to pregnancy. All right, Section 1, understanding endometriosis. What are we actually dealing with here? So what's really fascinating here is how the medical view of this condition has completely evolved. Traditionally, doctors thought of endometriosis as just a localized issue, defined simply as endometrial tissue growing outside the uterus. But today, it is recognized as a systemic disease. That means it impacts the entire body. It actually affects your liver, your fat tissue metabolism, and it causes widespread systemic inflammation. It can even change gene expression in the brain, which triggers both pain and mood disorders. So yeah, it is so much more than just bad cramps. You might have also come across the word endometriomas. These are specific cysts that are associated with endometriosis. Basically, what happens is that the endometrial tissue implants and literally inserts itself into the organs in your pelvis. That could be your fallopian tubes, your ovaries. Sometimes it even messes with the bladder or the bowel. When it forms these cysts specifically on the ovaries, that's what doctors call an endometrioma. Okay, moving right along to Section 2, spotting the symptoms. What are the actual signs you should be looking out for? The primary symptom, like the absolute biggest red flag here, is severe disruptive pain. And we are not talking about mild, annoying discomfort that magically goes away with a hot water bottle. Women with endometriosis experience intense pain that literally stops their daily life. We're talking deeply painful menstrual cramps, chronic abdominal and back pain, pain during and after intercourse, and even pain while urinating. If pain is interrupting your life, that's a major symptom we need to pay attention to. But remember how we just talked about it being a systemic disease? That means there are other tricky symptoms that kind of come along for the ride. Infertility, or struggling to conceive, is a huge sign. You might also notice heavy bleeding or irregular bleeding between periods. And then there are the stomach issues. Diarrhea, constipation, massive bloating, nausea during your period. Because these symptoms are so incredibly ambiguous, they often look exactly like IBS, endometriosis is frequently detected super late. So if any of this sounds way too familiar to you, honestly, you're seen and you are understood. Which brings us right into Section 3, getting a diagnosis. How do doctors actually confirm this? Getting a diagnosis is a step-by-step process, but thankfully it is a lot more manageable than it used to be. Step 1 is a really detailed medical history and a pelvic exam, which includes a speculum exam. Step 2 is where things have gotten so much better. It used to be that surgery was the absolute gold standard just to find out if you had it. But today, an expert radiologist can often spot deep tissue involvement totally non-invasively, using advanced transvaginal ultrasounds or MRIs. Step 3 is laparoscopy, but honestly, that's generally reserved for when it's absolutely, definitely needed. And just so we're completely clear on the terminology, laparoscopy is an invasive surgical procedure. Doctors use it to get a really thorough look at your pelvic organs to either confirm or completely rule out endometriosis. And they can also use it to actually treat and remove those tissue implants right then and there. It's an incredibly effective tool for sure, but it is really good to know that your doctor has those non-invasive imaging options to try out first. All right, Section 4, endometriosis and your fertility. This is the part that brings so many people to ART Fertility Clinics in the first place. Can I still get pregnant naturally? Honestly, if you're watching this, that's probably the #1 question on your mind right now. And I want to give you some real immediate hope here. The answer is yes. Many women with endometriosis go on to conceive naturally. A diagnosis is absolutely not a definitive end to your natural fertility. That said, we do have to look at the science of it all. This condition can definitely put some biological hurdles in the way of natural conception. Things like pelvic adhesions, which are basically sticky tissues that can literally bind your organs together, and of course, that systemic inflammation we mentioned earlier. Endometriosis can also distort your pelvic anatomy, physically messing with how an egg is released and transported. And finally, it can cause adenomyosis, which is a condition that specifically affects your uterine wall and just makes embryo implantation a little bit trickier.
So if natural conception is proving to be a struggle, a lot of patients naturally look into IVF, which brings up the next big question. Does endometriosis reduce your chances of IVF success? Because this condition can potentially impact your egg quality or even reduce your ovarian reserve, especially if you've had previous surgeries for it. It is a super valid concern.
But here is some incredibly reassuring news. IVF remains the absolute most successful treatment for folks dealing with endometriosis. By using highly personalized stimulation protocols and some really advanced lab techniques, specialists at places like ART Fertility can actually overcome those biological hurdles. The biggest takeaway here? When it's managed correctly, your pregnancy success rates with IVF are basically comparable to patients who don't even have endometriosis. Seriously, that is a huge, hopeful point to remember. Let's transition right into Section 5, Paths to Pregnancy. What are your actionable next steps? You know, fertility treatments really aren't one size fits all. They depend entirely on how severe your specific case is. For mild cases, doctors will often recommend IUI, that's intrauterine insemination, combined with ovulation induction. But if you're looking at moderate to severe stages, or if you happen to have tubal blockages, then IVF or ICSI, which stands for intracytoplasmic sperm injection, is considered the absolute gold standard. Both of these are fantastic, proven paths forward. Now, sometimes your doctor might look at your situation and actually suggest laparoscopic surgery before even starting fertility treatments, just to kind of clean up and improve the pelvic environment. So, what if they recommend surgery first? Well, this is a highly personal decision. You and your doctor really have to sit down and weigh the benefits of getting rid of those painful tissue implants against the potential risk of reducing your ovarian function, or in super severe cases, the risk of losing an ovary altogether. And this is where we get to some of the absolute best advice in this entire explainer. The ESHRE guideline, they're a massive European authority on human reproduction. They have very specific advice on this. They strongly advise counseling for infertile women who are looking at the surgery. And crucially, they recommend freezing your eggs before endometriosis surgery to preserve your future fertility. If surgery is on the table for you, freezing your eggs is a super concrete, incredibly empowering step you can take right now to protect those reproductive options down the line. Finally, we do need to zoom out and look at the big picture here. Endometriosis is considered a genetic and epigenetic condition. It's totally manageable, but it is a long-term journey. Even after you've had successful treatments or surgeries, the condition can pop back up. That's exactly why it is so important to build a consistent, ongoing relationship with your fertility specialist. Think of them as your partner. They're there to help monitor your health, optimize your chances for natural conception early on, and tweak your treatment plan as your life and your goals evolve. We have really covered a lot of ground today, right? From understanding systemic inflammation all the way to the pretty amazing success rates of modern IVF. So I want to leave you with one final thought. With the right team in your corner, endometriosis does not have to be the end of your fertility journey. The science is there, the tools are there, and the experts are ready to help you. So what step are you going to take today to protect your tomorrow? Thank you so much for joining me for this explainer. Keep asking those questions, keep advocating for your health, and I'll catch you next time.